Lymphedema is not life-threatening, it's not a medical emergency, so the speed at which you get to the doctor is how long's a piece of string. However, the advice is that the sooner that you get to the doctor, the better. The one time when it does change and it is crucial is if the infection is involved as well. So if I deal with infection first and then just look at lymphedema generally, signs of infection are redness, heat, tenderness, swelling. That doesn't mean that every single infection, cut finger that just becomes a little bit inflamed, needs to be sent to the doctor. If you're feeling unwell with it, have a temperature, feel fluey, then definitely you need to go to the doctor because you may well need antibiotics. If it's just a little cut, graze or a burn, watch it, see if it's healing. Do all the things that you would with a young child whose lymph system is immature. You could consider the affected side now as having, if you like, a less than mature system. So if you would be rushing your young child to the doctor at that point, then maybe you ought to go. But if you would be watching and waiting and putting some Savlon on and just cleaning the area, then I think you can also choose to wait. As I say, that if you are having symptoms of more of a systemic infection, of feeling unwell, high temperature, then you do need to see the doctor. With regard to the signs for lymphedema, it's usually swelling, no redness, no heat, no temperature, so that can be distinguished from infection. Swelling is the only aspect that is quite clearly seen.
If, on the other hand, they notice swelling, be it in a finger, hand, forearm, upper limb, or even on the chest wall itself, including the breast, then they should seek advice as soon as possible. And the reason being that the earlier treatment is undertaken, the more likely the swelling is to respond, and the earlier the treatment, the more chance there may be of even reversing the edema and getting almost back towards normal. Whereas lymphedema that's been allowed to establish itself, the natural history of lymphedema is to slowly deteriorate with time, and then there's at a greater risk of infection. The tissues undergo a more chronic thickening and scarring type change that is more difficult to reverse. So the answer is the sooner the patient seeks advice, the better.
Some of the symptoms that people will present with very early is just a sensation of it feels fuller, it feels bigger, it aches, which are all quite nebulous symptoms on their own. And if not having any obvious sign of swelling, it doesn't then mean that they don't have lymphedema. It's just a very, very early stage, and if treated well, may well disappear. If you find that your watch is not fitting anymore, or your rings are not fitting anymore, or your clothes are leaving marks, those are things that I would take as being markers of swelling, providing they're not also happening on the other side and just related to weight gain. So compare to both sides, put together your little picture of what is happening to you, and if you're thinking, I'm concerned about this, I'm worried about this, then make an appointment to see a healthcare professional. No, absolutely not. The risk is related to that particular area, so that if you have treatment on one side and develop lymphedema, should you then subsequently, as somebody who's in a position, have treatment on the other side, you're not any more at risk of developing lymphedema. As far as we know at the moment, you're not any more at risk of developing lymphedema than if you just had the one side.
I have it in my breast tissue.
Right.
Does that make me any more likely to have it in my...
In that instance, theoretically, you would think, yes, it probably would. But in practice, it doesn't seem to. In that if you've got the drainage routes on one side, at a deep or a superficial level, affected so that you've got swelling here, theoretically you would say, well, this area is going to suffer because it's got a waterlogged area here that's not helping it. This will be more at risk. But it doesn't always seem to work that way. I was surprised to find when I looked at people, they did almost seem to be a separate entity. There are some people who will have arm swelling with breast swelling or with trunk affected. Others don't. Doing the exercises will help reduce your risk. because it will encourage drainage routes to open up. Because that's the main aim. Where you have an area that's waterlogged, you want to encourage as many of the surrounding areas to open up, to work at their maximum. I think one of the biggest fears people have is what effect will lymphedema have on me if I develop it? Will it affect my work? Will it affect what I wear? Will it mean that I can't do certain things? And that is really an unknown. My advice is that it should not have much impact on your life at all unless you choose to allow it to. There will be certain things that you may need to adjust, either temporarily whilst the lymphedema is being treated or permanently, but it will be a life choice issue. Certain things that we advise, like not wearing tight jewellery, are things that should already be in place to help avoid your risk being increased for developing lymphedema. But you would definitely need to consider making alteration to your clothes if you're used to wearing tight, restrictive clothing in any way, or have tight bangles, watches, rings, etc. In terms of job, I think the main thing is looking at what you do, what is the effect on you of what you do. If your work is very repetitive, particularly clerical work, filing, typing, it's putting into place things that break up the repetitive movements and provide exercise as you work. If your work requires you to stand with your arms down for a long while, putting in place simple arm exercises. So I think it's less about what it will stop you doing as what do you need to do to enable you to carry on living a normal life. Lymphedema can be lived with a normal life, it can be minimised and hopefully kept very, very unnoticeable, or even with treatment maybe completely removed. Although even if you get rid of lymphedema, you're still at risk of it developing again should circumstances work against you. You overload your system, have an infection, another illness, etc. So it's not once you've got it, that's it, lymphedema for life and it's only going to get worse. We don't know which way it will then go. Hopefully with early and appropriate treatment, you'll get back under control and be back in the at-risk situation. The difference will be that you, if you develop swelling, get it back under control, will now know you're at risk, not just treat yourself as if you're at risk because we don't now. You now know that your system is not as good as you'd like it to be. So that may or may not make a difference to how you then play risk.
Well, my philosophy with lymphedema has always been to try and get the patient to live a normal life, as normal a life as possible. And in terms of activities and recreational pursuits, again, I've encouraged them to do it, largely because I don't like lymphedema to be seen as a disability, even though it is. And the reason I take that view is because movement and exercise underpins management of lymphedema. And if you start restrictions in terms of daily activities, then that will compromise, I think, what one can do in terms of encouraging movement and exercise. So I get quite a lot of letters from patients and healthcare professionals asking, can I play tennis, or I've been told I cannot go on a long-haul aeroplane flight to Australia. And I always say go for it, but go for it sensibly and in a graduated way in terms of exercise. And as far as an aeroplane flight is concerned, I would say do it, wear your hosiery, inform the airline, make sure you get up and walk around, take regular exercise and limit the problem and tell them not to worry. Okay, the swelling may be worse when they get to Australia, but if they do all the right things, it won't create a major problem for them and they can still get on and enjoy their holiday and still play tennis and do what they want to do. So I think that's very important.
I think with regard to exercise, there's two forms of exercise. One is purposeful exercise where I set aside time and I follow a regime. The other is exercise as part of my daily activity, and they need to almost be seen as two parts of a whole. I've actually put together something which I don't think existed before, but in terms of improving the lymph system, there's a particular sequence that works, and I certainly suggest that it's followed through. It's 10 minutes, 15 minutes max as a programme. Can be done once or twice a day depending on the individual.
So if they want to undertake exercise, they should always do it within their normal limitations. So it's straining a limb that probably is not good for lymphedema. So this is why picking up a suitcase might be normal exercise, but it's actually putting excessive strain because it's a movement that is one step too far in terms of putting strain on the limb. After all, lymph drainage depends on a very gentle form of exercise. As soon as strain is put on a limb, then you increase the blood flow and you increase the amount of fluid that is actually being distributed through that limb, which then the lymph drainage has to respond to. So exercise that stimulates the lymph drainage without perhaps increasing too much muscle blood flow is a good thing, and therefore using all the muscles but in a gentle, regular manner is the best advice I can give.
It's counting risk, or choosing not to count the risk but then taking the consequences. And my feeling is that there's probably little that you want to do that you can't do if you properly train for it and take into account the cost. In fact, people go back to playing golf, going back to running, but you have to train for it. How about other people who've chosen not to go back because they didn't want to take the chance? That was their choice. They find other things to do. Hopefully they're happy with the choice they've personally made. I think where you've been doing sports and activities before, the issue is fairly clear cut, that providing you go back in and retrain to do what you were doing before, I don't see any reason why you can't. Providing that you train, you don't just jump back into where you were before, because your body, a bit like if you have flu, you have to then start building back up again. You just can't assume you'll slot straight back in where you were without injury. And the other thing is that you monitor. You probably need to train a little bit slower or take longer at each stage to get back to where you were before, but also that you monitor, are you able to go back to where you were before without injury? Because the taking slower on the stages just gives you that time to settle. Is this causing me a problem? Because it may take several days for a problem to emerge. And if it doesn't, then do I want to go up to the next level? Yes, I do. Retrain, stick it there for a while, and then until you get to the point where either you're happy with your progress or you decide it's too risky to take it any further. I'm starting to get symptoms, I'll stick at this level. I don't think that as lymphedema specialists we would have particular advice about diet other than aim to live healthily, keep your weight within what would be considered to be normal limits. The specifics of how you do that is probably something that you personally need to decide, and if you need advice, go to a nutritionalist, a dietitian, ask your doctor for assistance in that. Some people have asked whether specific dietary recommendations to assist with either preventing lymphedema or treating it if it occurs. There's no evidence that I'm aware of to suggest that altering your diet will reduce your risk of lymphedema or will treat lymphedema if it occurs. The information that's available at the moment, the research that's been done, has only suggested that keeping weight within normal limits is important.
Well, healthy living is of course always advisable, but in terms of diet, there is no diet known to be helpful to lymphedema except a weight reduction diet in the case of obesity. Obesity is a risk factor for the development and progression of lymphedema, and we know that. Therefore, trying to keep weight optimal is an advantage, but the diet itself is not influencing lymph drainage.
One practical thing, in case you haven't thought about it, is make your work work for you, not against you. How many of you work at a desk? Computer work. So quite a few of you. Some of the advice that's given to people is come close, get everything as close as possible to you. I would actually suggest the opposite. Make everything work as far away as you can healthily do. One thing, the recommendation is that you don't sit too close for things like RSI, so moving away. But also, it then means that you're stretching for your phone, you're stretching for your pens, you're stretching for, and you're just doing an exercise without even thinking about it. To get your pen, you've got to do an exercise. So don't just put it down in the easiest place, put it back, because then it makes an exercise for you straight away, and use the arm that's on the affected side. Because that's the other thing that often people assume from the advice that's given. Avoid strenuous repetitive movements, so I won't use that arm. I would recommend you use the arm, because by doing so you strengthen, you tone, you condition the arm to do the things that you want it to do. Whereas if you don't, there comes a time when you have to, the arm isn't ready. Okay, with regard to the telephone, I would suggest that you don't use your affected arm, because if you hold the telephone to your ear with your affected arm, you've got your arm in a closed position, a bit like having your blood test slow down the drainage so it can heal, yeah? So that if you can use it in the unaffected arm, would be much better. Now that's a bit tricky if you are needing to write with one arm and use the other one, but if you are, and try not to cradle it, because that again reduces your drainage routes in that affected side, quite apart from being generally not healthy. The rationale behind moisturising is to get your skin in as supple and healthier condition as possible. As we get older, our skin naturally gets drier, and therefore we're more at risk of injury, we're more at risk of infection. So the aim of the moisturising is just to give your skin as good a help at staying intact. Where skin is dry, it's got tiny breaks through which infection can get. Somebody who's had treatment on the left side, it's the whole of that left quadrant, upper quadrant. So moisturising is not just the hand, it's the arm, it's the breast area, and particularly if you've had radiotherapy, it's the back as well, because that will have been affected. The main aim of moisturising is to keep the skin as young, supple, bouncy as possible, so that if you do have knocks, cuts, grazes, you're less likely to do major damage. The actual moisturising cream that you use, I don't personally think is that important. It's what is suitable for your skin, what you feel comfortable wearing. Men generally don't like wearing perfume creams. A lot of women now don't, because they may be sensitive to them, or that they're putting their fragrance on in some other way. So a bland cream that actually suits your skin, try them out. It doesn't have to be expensive cream either. Creams tend to be a little bit heavier and work in better than lotions, which have more water base to them. If you're washing your hands a lot, you'll need to put more cream on, particularly if you have a tendency to dry skin or to chapped skin around the cuticles.